Welcome to the second episode of Radiance, a Republic of Radical Healing with underpinnings of the Republic of Hugo culture, all kinds of underpinnings. And so I just want to say welcome, strap on your crash helmets. This I'm going to be all over the chart today. So as mentioned, promised, whatever, I'm sharing today a very tight edited version of the video that the doctor so graciously allowed me to shoot when he went over the PET scan with me, and so obviously I'm going to cut that down. And the reason I'm sharing is simply to kind of segue into some of the things that then come with that first meeting, and why that first meeting can be so critical in your healing. And so it's just like this. Yes, this has a Wendell component in it, of course. You know, this is my cancer, my story, my ongoing cancer, my story. Okay, but I'm trying to keep that in check, keep my inappropriateness in check. That's for my children, but it's also about education, and hopefully if I can get just one dude to go get his PSA and it makes a difference, I'll be so happy, okay? Because it is so simple, guys. Just get your blood work done. Get this one test, because you don't want, you don't want to do this. You don't want to do this. I'm so serious. You see these things? See these? Oh, pray me. You see the length of that? It's kind of hard. Yeah, but you get the picture, right? Oh, look, another one. Oh, yeah. Look at these suckers. Okay. Those go in your orifices. Okay? If you like that kind of thing and you want to do that and you want to die real fast of cancer, then go ahead, wait. Yay. On that note, my being sarcastic there kind of brings me into, or cynical, brings me into the second component of today's episode, because it's a quick down and dirty as to the first visit, etc. And then what really struck me, and has been in all of my research, and I'm doing a lot, and one of the big things is words. How much words matter, okay? And so this will be a theme about words mattering, and we are what we eat, okay? It's really very simple. Cancer, a good portion of the time is our creation, my creation. I created it. I didn't have a DNA, didn't have history, blah, blah. I did use a lot of Roundup. But anyway, overall, it's what I ate. Okay, so all these pieces are going to come together, but today it will be for this episode 2 and for several to come, because I really want to get into this words and emotions and this kind of stuff and how it matters. I remember I used to hang out with my dear buddy, and we thought we were so sophisticated because we were cynical and critical and sarcastic, and ooh, that made us whatever. What a silly way to be. And it hurts people. It hurts them dramatically. And it's such simple things as like tone and the words. So just take a breath before saying some of these things. Take a breath before I say some of these things. And so I call it snarkdom. And so we'll be drifting into the kingdom of snarkdom in the second half of episode 2. And so I just wanted to touch base on that. I got your PSA. Hey, hopefully this is going out today. So it's Son's Day. So love your sons, man. Let them know. Show them you love them by getting a PSA exam. Love them by talking about prostate cancer. Love them about talking to them, with them. So I'm so blessed to have a son. So blessed. That I have not the words. So thank you, son. I love you. And then this is about gratitude. This has to stay on track with gratitude, because there's no bigger word, gratitude, gratitude. It changes the structure of the vibes of the day. I'm telling you, I promise you that. And so we will work on that. I will work on that. Okay. Wearing this elephant bling today, and this level of bling is a little over the top for me, but it is kind of cool, and it's in the appropriate elephant tusk going up, which means good luck. Okay, but more importantly, it's about the phrase, "There's an elephant in the room." Okay, and that's why I have this, to remind me to toss that into the mix here about words. Okay, and on that note, there's some words here that I have that, quite frankly, I had to look up for some of the spelling and stuff. I did not know there's an fMRI, but there is, and it's basically an MRI machine that doesn't just take snapshots of your bone structure or your brain structure. It watches blood flow in real time to see which parts of your brain are more active when you think, feel, and react. Okay, and then the amygdala, that's it's a pair of almond-shaped clusters deep in your brain, one on each side. Think of it as the brain's smoke alarm. It reacts to danger, stress, or perceived threats, even if that threat is just someone's sharp tone of voice. That sentence, that's a huge sentence. Okay. Okay, and when it lights up, it signals your body to release the stress hormones like cortisol, and that's not going to be a benefit. And then the nocebo. This cracked me up, because it's the dark twin of the placebo effect. Placebo, you feel better because you expect to. Someone gives you a sugar pill and tell you you're going to feel better. 9 times out of 10, you feel better. Okay. However, the nocebo, you feel worse because you expect to. Okay, example, if a doctor says this treatment is going to cause terrible nausea, many patients will feel sicker even if they were given a sugar pill. In short, words can program the body to suffer. And what's wild about this is that when I started the radiance treatments, and just that alone, when I changed it from radiation to radiance, and I decided that I was not going to have the side effects. I was not going to let it take me down. I was not going to be, a grumpy little bitch. No. Instead, I flipped it into, this is my chance to give back. And I am so grateful. I'm so grateful to the system that we have that allows us to do that, to shift on a dime. And that's why words are so critical in the prevention of cancer and the healing of cancer. And we will get into this. I mean, right down to, it's like addiction. People with addictions tend to have cancer more often, right? Okay, and just like if you've watched plants or water or anything, there's all the scientific studies that clearly show how our words affect plants, how it affects water, how it affects the very vibration that transmits between us. So words, yeah, big deal, and especially in this rodeo that we're talking now. Man, get your words in order. Wendell, get your words in order. And so that's where this begins. What else I got here that again, I want to thank my doctor there at the Adventist Health Cancer Treatment Center, who got me the PET scan, actually got it for me early, then sat me down and walked me through it in a most clinical. I give it to him. I don't know how I could do that. It was because I was scoring the highest I could in the top 4% in the country as far as bad. Those who know me, yeah, gotta go big or go home. And so there wasn't a lot for him to say. And so he came very clinical, but you got to be ready for that. And so I've added a few notes here today as to how you might want to handle that a little better than I did. And let me see here what I got going. Hey, so welcome back to Radiance. A Republic of Radical Healing. This is episode 2. Episode 1 was about setting the vision. This one drops us into the cold fluorescent light of a doctor's office, into the moment a doctor looks at a scan and tells you something your body already knew, but your heart didn't want to hear. So the video exists, me sitting across from my hormone oncologist at the Adventist Cancer Center, as he scrolls and explains and then says it flatly that I had advanced stage 4 cancer, Gleason scores that are this and that, and the words landed as antiseptic, clinical, stripped of warmth, that was stuck, like being told your house is on fire in the tone of a weather forecast. Okay? Most of us are not ready for those moments. We walk into those rooms, the doctor's office, naked, emotionally and spiritually, hoping for kindness, clarity, and maybe even a miracle. But what you need is a checklist, okay? I could have used one. Okay, bring a witness. A second pair of ears. You won't remember half of what's said, but it would help to have someone else hearing it. Record it on paper or on your phone, because memory falters under shock, okay? And I had already been told that I was a winner, but this was a shock seeing the volcano. Write your questions in advance, even the small one. What do the numbers mean? What can wait and what cannot? Ask this magic phrase. If you were me, Doc, what would you do? He won't say. She won't say. And breathe. Breathe, breathe, breathe. The doctor delivers information, but you get to decide how to metabolize it with your mind, your spirit, and your body. Choices, choices, choices. Which brings me to tone, because it wasn't what my doctor said. It was somewhat how he said it, and this guy was great, okay, but he was a doctor. Flat, almost dismissive, like a shrug with syllables. And so this is where this part 2 of this episode is the kingdom of snarkdom. And like I said, I was the king of sarcasm and cynicism, and it's this snarkdom. Words are arrows dipped in vinegar. They don't kill outright, they erode, they sting, they lodge in your nervous system like splinters. This isn't a metaphor, this is science. Neuroscientists, technology, using fMRI, okay, we discussed that, have watched the amygdala, the brain's smoke alarm, flare up when people hear hostile or sarcastic tones. Even when words are neutral, the tone sets off alarm bells. The alarm dumps cortisol. And here's the deal, the stress hormone in your blood system, and here's the deal. Cortisol suppresses immune cells, especially natural killer cells, the very soldiers that hunt cancer in your body. This is the nocebo effect, the flip side of placebo. When doctors are negative, when they use negative language, patients literally feel worse, experience more pain, even suffer more side effects with no change in treatment. Harvard study showed that when patients were told this might hurt more, they did feel more pain. Words become biochemical instruction. Hostility slows healing. At an Ohio State research, they studied couples, and when they fought with hostile tones, their small wounds healed 40% slower than couples who argued gently. Blood tests showed higher inflammatory markers like interleukin-6, a chemical linked to cancer growth, heart disease, autoimmune flares. Sarcasm literally slowed the skin from knitting back together. And bedside manner matters. A Johns Hopkins review showed that when doctors spoke warmly, patients recovered better, less pain, less anxiety, more adherence to treatment, same medicine, different tone, different outcome. Now, I'm not banging on doctors, I'm just saying, okay, this is where the science is coming from. So yes, the words we speak matter. They can heal or they can poison. Remember, Mom said, if you can't say anything nice, don't say it. Duh. And when the flat tone hit me in the PET scan room, it felt like I was sitting on a porcupine. Spines below, snark above. Not fatal, but painfully unforgettable. Maybe you've been there too. Not in oncology, but here we go. But in a family dinner, a job review, a marriage. One jab, one sarcastic shrug, and suddenly your body is in a biochemical storm. That is the truth. That's what so what's the way out of snarkdom? Not silence and not more snark. The antidote is presence and choosing words like hands instead of arrows. Because if tone can open the stress tap, tone can close it. If words can erode, words can also restore. Gratitude, gratitude, that kind of thing. Healing is not just in the scans, just not behind the drugs. Healing is in the music behind our words, our words. So let's tune ourselves. Let's tune ourselves. Let's notice when we're in snarkdom and walk back into radiance. Okay? This is step one. This is step one in not only preventing cancer, but the cure of it. And if you can simply apply it to everyday living, you are moving onward to radiance. Okay? And so we can receive snarkdom and embed it into our souls, or we can say no. You know, we don't have to subject ourselves to it. We don't have to, we don't have to have a fist fight over it. But I mean, just move yourself away. We know the people that we're talking to. If we're talking to people that we commonly speak to, we know how they're going to react. We know what they're going to say. And so if I then feed that and I get that reaction, well, then that's on me. Okay? So it's choices, changes, and challenges. Okay? And so what we have here today is we have Wendell's start. And hopefully you have a few ideas as to how you would handle this if you're in the same situation. How you prepare for it, what you do when you're there, but the main thing is look for support. Look for support, because I cannot tell you the critical nature of that. And I have to shout out to the supporters, right? The caregivers. That is the hardest job there is, okay? And so we all struggle. We struggle with words. We struggle with feelings. And it's so easy to let tone slip into the abyss. And so I'm just saying, whether you have cancer or not, a better way of living is to eradicate words, behavior, tones, whatever, that harm. Okay? That's what I can do. If somebody, I'm not going to be able to change someone else's platform on that, right? If they get off on it, there's nothing I can do about it. Nothing you can do about it. Except not put yourself in front of the arrow, right? That's been dipped with that poison. And I mean, is that not fascinating about how it actually affects the body? We know that. We know how it affects plants. We know how it affects water. We know how it affects our animals, who are way more attuned than we are. Okay? So put a little love in your heart today for everyone, because we are in a challenging time. And so what I want to bring to this, and I'll have a bigger, badder package next episode, pretty much same topic. It'll still be on the emotional nature of cancer, where it comes from, how it comes from emotions, some of it, and how we can cure. And the reason I'm saying that is because the whole thing behind radical healing was before I went in to be radiated, okay, and or started this hormone therapy, which, boys and girls, holy moly. Again, boys, if you don't want any of this, and you don't want your testosterone dropped to a place where it's undiscernible, It's not there. No testosterone. Imagine that. Try that out, okay? And when you're sweating through your, I don't have hot flashes. I'm just in a flash, in a constant state of sweat, okay? So, just saying, guys, simple test, simple test. And so here's one of the last things. This is my elephant here, okay? This is the lesson of the day for me. The phraseology, there's an elephant in the room, came up a few weeks ago, and for me, and I'm like, it's so amazing how all these adages and all these things of wisdom from the past and beyond still apply to today. And so when we talk about an elephant in the room, that's that thing that nobody talks about, right? We all stand around that elephant, and we all know what the elephant is, and we don't talk about it, okay? Well, here's my lesson. Here's my lesson, is that, hey, maybe we're not going to talk about it. And so, what happens? Well, one, it's a difficult place to be in. But two, this is what I decided, is that the elephant is mine. Okay, I can promise you, whatever that elephant is in the room, if that elephant is in the room with me, I have something to do with it. Okay, whether or not it's in its entirety, I'm a little packy, or some portion there is of, because breadcrumbs to all of this always come home. I don't care what happens in our lives, I can promise you the breadcrumbs come home. If you have the wherewithal to actually be honest with what's going on in your world, you're going to find that pretty much it's being created by you. If nothing else, it's how you react to it, your choices to it. And so when you have this elephant in the room, this is again what I kind of like the elephant. Okay, it's pretty cool. So this baby's mine. I'm going to accept the elephant as is, and that's going to be just good enough, right? It's the elephant in the room. And then the second piece of that is the room is mine. Okay, so the elephant and the room are mine, my choice. And so as long as it's not something that's hurting others, as long as like in this particular situation, the elephant a few weeks ago, it was hurting me, okay? It really wasn't my elephant. It's only my elephant because I'm a part of it. And so that was my choice, was to accept the elephant as mine and to accept that the room that the elephant is residing in is mine. Okay, and this is not denial. This is not. It's kind of just part of self-care. Because if I got all involved with this elephant, I'd probably get stomped into the ground. And so it's just easier that when I went, what it would take to dissect this elephant would be way beyond the benefit. Once we figured out what that elephant is. So I hope you're not lost on this, or Wendell, what the hell, or thinking that I'm saying we shouldn't deal with the elephant in the room. But sometimes I'm just saying, if you take a look at it, like everything else, it's yours. It's yours. And so thank you so much for spending a little bit of time with me, and man, we're gonna have some good times here. Like I said, I'm going to be inappropriate at times. There's gallow humors. There's, how you say, well, how's cancer funny? Well, it is funny. There's funny things, man. There's some real funny things involved in cancer. When you start talking about 12-inch nails, let me tell you. So I love you. I cannot express the gratitude that I have for Wendell's nation, so to speak. And here's the final on that. I'm all like, wow, all these people love me. All these people care about me, care about me. Well, you know what? You did. Always. And before. It didn't just happen. I just didn't accept it. And I apologize for that. I apologize. To have love handed to you and you don't take the hand of it, man, that's cheeseball stuff, man. And so, I'm sorry. I really am. Thank you for writing it out with me. I have just, so many people stayed with me, and they're here with me today, okay? And so when I have words with you, I'm going to do everything I can do to make those words of benefit, okay? To be something that we can all learn from, something we can share from, and again, that's the objective here. The objective is not grinding into my story, and I'm going to say things. My perception is my perception. That's all. That's all. We're watching the same movie, but I'm the star in my movie. You're the star in your movie, and all we can do is be really good supporting cast members. Okay? Let's just be really kind to one another right now, and because here's the thing. What I want a big piece of this to be is the educational component, that there are alternatives to the AMA and Big Pharma. And I'm not, trying to whatever. I'm just saying, cures, etc., have been going on for a long time before organized Big Pharma, AMA, whatever. Around the world, cancer is healed every moment of the day, right? And a whole lot of that, again, goes back to words and attitude. If your attitude is, I'm dead and dying, well, you'll win. If your attitude is, I'm grateful for the nanosecond that I'm living in right now, I'm grateful for what I'm surrounded with, I'm grateful for the forgiveness I've received, and I'm going to live in a place of gratitude, I can guarantee you I will be living a lot longer than I would have. And I owe that to all of you out there and to so many more. And so yeah, check it out. Radiance 3 is right around the corner. Okay, thank you.
So I got the pictures
Okay.
of your scan, and it's pretty much consistent with what we talk on the phone. There's pretty extensive lymph node involvement, actually.
Okay. When you say pretty significant, I mean more than.
What's more than what I usually see. I
Really?
think it's like about, on the top of my head, about 13 lymph nodes. It's a lot
13 are affected?
that we see.
Really?
Now, of course, when we treat not just the one that we see, we treat the volume around it, but
Right.
just the number of it is more than what I typically see. These days, at least.
Okay. Well, I always do things big, so.
Yeah. So when do you see the surgeon at UCSF again, Dr. Carroll?
Well, what happened with that is I still have, it's mid-March, but
Okay.
but what they did is because he's in the surgical, they said, listen, you need to get over to radiological to establish care. So
Really?
I bounced around, and their referral now from my provider went to that, and so I'm waiting. Because the idea was originally they were trying to get me in earlier, and so that's kind of.
So are you still seeing Dr. Carroll or not really?
Yeah, I am.
Oh, okay. So but then you're gonna have to see someone else.
But
in addition to that.
yeah, because they didn't. The people calling didn't understand what he knew about the process that I'm in particular interested in.
Got it. Okay. So so these are not lymph nodes, okay? This one that's your sorry, let me remove my hand. That's your ureter. So up here is your ureter. That's okay. That's not a problem. Let me double check though. So we are here. Yeah. Yeah, that's the ureter. Okay. So that's the ureter over here. So that's the thing right here. But this one, that's one lymph node here, right? So we can count them. Let's see. So that's 1, that's 2, 3, 4.
Wow, they really light
5,
up, don't they?
6, right? 7, 8, 9, 10,
Good Lord.
11, 12, 13. I'm at 14 there. Yeah. So, and your prostate light up the whole thing. It's pretty.
Okay.
So
Now the question is so there isn't any other than that little tail off the prostate there. I guess that was lit up too, right?
no, I think that's one like just a nearby lymph node.
Oh, okay.
But then they all kind of involved, and this part is a bladder. That's okay. That's normal. You pee the drug out, so that's not this one. The middle part is not cancer. That's just a bladder.
Okay. And then you said the bones are good.
The bone looks okay to me, and the report say it looks okay too. So
and organs.
Yeah, that's all okay from what I.
So
let's go over the report again.
It's pretty contained, actually.
Well, yes and no.
Okay.
It's technically it's not metastatic, but with that amount of lymph nodes, that's a lot.
Okay. So when you say it's not metastatic,
it's not distant metastatic, I should say.
Okay.
Because usually we say anything outside the pelvis is metastatic.
Right.
So if you have let's say if it's just a lymph node, but lymph node in your chest, that's metastatic.
Okay.
Now it looks like everything is in the pelvis, so
Yes.
it's not. But still, just the amount of it is worrisome to me. We don't see this a whole lot often. At least me.
Okay.
So.
Okay.
Now, given this amount of lymph nodes, I don't know, and also, the thing also, another thing is that some of these lymph nodes are not where we would typically treat. And with the PET scan these days,
Right.
we're finding more and more of these perirectal lymph nodes.
Okay.
Historically, we don't routinely treat them as an elective volume.
Okay.
But because the PET scan is so sensitive, I've recently, since we've started doing the PET scan, I've seen more and more of these, perirectal lymph nodes, like for example this one.
Okay.
Normally we don't treat back here.
Okay.
Before we had a PET scan and we didn't see, and if we didn't see anything, we would typically stop the treatment around like the side, but I wouldn't go all the way back near the rectum.
Gotcha. Okay.
But of course, when we see it, it wouldn't make sense to not treat it.
Right.
So because of that, right here, your treatment volume, let's say we do the radiation, but your treatment area is going to be a little bit bigger than a normal situation because you have these perirectal lymph nodes.
Okay.
Right. So we would treat the tissue around the rectum too.
Okay.
So usually we don't go back here.
Okay.
But because you got lymph nodes back here, it wouldn't make sense to not treat it.
Okay.
So that's one thing is, in terms of side effect, you're probably going to have more risk of rectal bowel side effects because we have to treat more rectum.
What does that mean?
So you'll be at risk of more side effect to the rectum, like
what?
bleeding, proctitis, diarrhea, discomfort when you poop, that kind of stuff.
Okay. All right.
Because just the fact that we have to treat more area around your rectum.
Okay.
So in terms of side effect, that will be one thing that's going to be different than a garden variety case.
Okay.
Right? And then two is that you have so many lymph nodes, and when that lit up. So when we see lymph node that light up like this, we try to give more dose to the gross disease,
right,
than microscopic disease. That makes sense because when you see it on the scan, that means there's a lot more tumor.
Right.
So because of that, we typically give more dose, and by definition, it will also potentially increase the dose to your normal tissue that surround these organs.
Correct.
So again, that's why I was saying maybe a little bit more bowel risk, right? Bowel, maybe even bladder risk. So rectum risk, because again, this lymph node now have to go. Not even I'm treating it, but this one particular spot, for example, are going to go to a higher dose compared to like something elective over here, right? Where we don't see anything, but we still worried that's microscopic disease.
Okay.
So.
Now, is this available on my chart or whatever?
The picture is not.
Okay.
But you can request the CD also from the place you get it done.
Oh, I have a CD,
Oh,
but
okay.
you can't.
You can upload on your computer. There's a little
It will?
there's a little viewer in there. You can
Oh, okay. I
This
mean,
one.
I had to move it to a USB stick, but yeah.
But yeah, you know, there's they when they do the disc, they include a viewer in there. It's not gonna look like my viewer, but
Right.
It's like they give you a little
It's just I
software.
don't have a CD reader anymore. Anyway, okay.
Yeah, most people don't. So.
Yeah. Okay. All right. So that's a bummer.
Yeah. So another thing I want to check is. Yeah. Now, the more I look at it, though, I just happened to see this one that they didn't talk about. This one is a weird one because that's pretty much way out, not where we normally treat. I don't know what that is. You know, see this one right here?
Yeah.
So. But I'll just call the radiologist over at the PET scan center and just talk to them about
Okay.
it, the one in front of your bladder. That look a little funny.
And what do you mean by that?
It's just a weird location where normally we don't treat in the middle like over here.
Okay. Right.
But yeah, so I see something there. Yeah. But yeah, you do
So
have.
there's pelvic bone there, and that's clear.
Well, the bone is clear, but
Yeah.
to be frank with you, with this amount of lymph nodes, I mean, it's still gonna.
No,
It's not I would say it's it's not quite that bad, but it's not it's not great.
Yeah.
Yeah. So for now, I mean, I'll discuss this one little spot with the radiologist at the PET center.
Okay.
See what they think. But this is also the weird one because usually we don't treat out this far out either.
Okay.
And I haven't seen any lymph node in that area before.
So then, how do you know that it's not even further out?
Well, that's the issue is that these scans they're not perfect. They only
Right.
picked up when there's a certain amount of cancer. So
And there's a certain area. So
so that's why when we treat we treat not just what we see but also the area at risk around it.
correct.
I think what you're alluding to is could we miss cancer in your bone or other organs? Is that what you're alluding to?
Kind of.
Yeah, absolutely. That's always could be possible. I mean that.
Okay.
And in your situation, the likelihood of that is quite high because you have so many cancer in your lymph nodes. So the chance of this coming back is actually, I think, is probably quite high.
Okay.
Or the chance of us missing stuff on the PET scan is also quite high,
Okay.
like microscopic stuff.
Gotcha. Yeah. Well, that's what my ignorant little run.
No, you asked very intelligent question. I think.
And it was my little run on AI too. That's talked about those little microscopic ones that you're talking about
Yeah.
that are a little harder to discover.
Yeah. And of course, let's say you didn't have any of these lymph nodes, the probability of that's going to be lower.
Yeah.
But with all these lymph nodes, that raises the odds
Correct,
that
correct,
So
correct,
yeah.
correct.
At this point, we kind of bias because we've seen this PET scan, and we know.
Okay. Jeez.
But regardless, I'm not too confident that anybody would operate. You can talk with Dr. Carroll and see.
Here's the thing. So let's tell me something good.
Well,
in other words,
so on paper, we still could try to do what we call curative treatment with radiation.
right,
Now, of course, I need to clarify that little spot
right.
in front of the bladder. There might be a second one here, but I have to double check with the radiologist and see what they think. I'll present your case at our tumor board as well.
Okay.
Once I've had a chance to talk with the radiologist over at the Northern California PET Imaging,
And
see what everyone else thinks.
When would treatment start?
I mean, Dr. Walwyn already gave you the prescription, right? For the
I'm taking a pill.
yeah. So that you, in essence, you pretty much just
That's
already
hormone.
yeah, you already started.
Right. Okay.
That's
right,
part of the
right.
treatment.
Okay.
So in terms of curative treatment, really the main thing is the hormone and radiation. I don't think they would offer you surgery with this much cancer of the lymph nodes. But again, you see the surgeon in a couple of weeks anyway. They'll let you know one way or another.
Yeah.
I
understand that. I mean, why make the body weaker when you got to radiate it anyway?
Well,
right?
It's just sometimes they do, but with this amount of lymph node, I don't think they would. But,
right.
Okay. And then another thing is the radiation. When do we start? So typically, we start the radiation after 2 months of the hormone treatment.
Oh, okay.
So in about end of April.
Okay.
Give or take. So I'll see you typically. So what we'll do is I'll see you back in 4 weeks, see how you're doing.
Why do we wait that long?
So it depends on where you train, but in my kind of training, where I train, we do that just because it's the school of thought. The school of thought is that where you want to give them the hormone time to work and then kind of starve the cancer out. So
what does the hormone treatment do?
So it blocks the testosterone. And
Correct.
so it starves the cancer out in essence, because the cancer feeds on it.
Oh, so it's okay because it blocks the growth of testosterone, right? Which then is it the testosterone that the cancer feeds upon?
Yep. Mm-hmm.
Okay. So you suppress the testosterone, and like you said, starves the cancer.
Yeah, in essence. Yeah.
Okay.
So, so that's what we do here, as well as where I train is we typically do hormone before the radiation, and typically we start the radiation about 2 months afterwards.
Okay.
It's not a hard time point, but that's kind of what we try to stay with. So usually, when you start a hormone, I see the patient about a month afterwards, see how they're doing, make sure there's no issue, and then we would go ahead and do the mapping a week or two after that.
Okay.
It'll take me a week or two to plan it. So after that, usually you start about 2 months afterwards. So.
Okay.
Of course, that's going to be dependent on what the radiologist tell me about the other stuff. But these, I would say that's an unusual area.
Okay.
Yeah. Sometimes you just might have some kind of other thing that light up that normal but not cancerous, but that's why I need their expertise on that one too.
Is there anything that I can do at all to help?
The most important thing is when you start a treatment, you gotta make sure you stay with it. You complying with the regimen. That's the most important thing.
Of course.
And then two is in general we don't recommend you to take testosterone. Right? Some men may go and take some testosterone supplements. We don't recommend that.
Oh, supplements like what?
Testosterone supplement. We don't recommend that. No. Other than that, in general, of course, with anybody, try and stay active as much as you can,
and diet,
and that's just overall health. But beyond that, really, as long as you kind of, just whatever treatment you do, you stay compliant. I think that's the best thing to do.
I will be compliant.
Yeah. So. Other option, well, if let's say you don't want to do the radiation because now I'm telling you about the risk is higher, then beyond that, really that's not really a curative option. So the curative option typically is either radiation or surgery.
Right.
Beyond that, you're talking kind of what we call quote unquote palliative, where we try to control this for as long as we can, and typically that involves the hormone treatment, and then sometimes they may add other medication on if things don't look good, or you are right now. Dr. Wang would recommend you 3 drugs, right? The bicalutamide, which is what you're on right now.
Okay.
And then looks like he'll start you on the Lupron, and then another one, the abiraterone.
When do I start those?
Oh, I'll refer that to him. Yeah.
Okay.
Yeah, those are his drugs. So.
Okay.
But typically though, they start you kind of. Like the right, usually the shot should be happening pretty soon here.
Okay, so how do I? Because I don't think I have an appointment.
You should. Let me double check. Sorry, there's other paper and stuff.
Yeah.
You just saw him not too long ago, right?
Well, I saw him the same day I saw you.
Oh, I see.
Yeah, and it was very brief.
Oh, really?
Because this, like you said, surgical was not on the plate.
Oh, you mean no, the guy here?
Oh,
the hormone, the doctor that gave you the hormone.
Right. Is he the doctor that you're talking about?
The older Asian guy?
Yeah.
Okay. He doesn't do surgery though. He does chemo and hormone treatment.
Oh, okay. he's the one then that prescribed the drug.
Yes,
right?
yes. So
Right.
that's why what I tell you,
Right.
you know, I'll refer that to him because he's
Correct,
the one prescribing. So I.
But I mean, so.
But let me see though. I can tell you when you have an appointment because they wouldn't just not give you a follow up. That would be unusual.
Okay. Well, and Laura handles most of that, so I'm not saying it isn't.
Oh, no worries. No worries. You got a lot on your plate right now, so I
A little
get it.
bit, yeah.
But no, it's good that you already started the hormone treatment. So,
Yeah.
So let's see. Right now, you are correct. You don't have a follow up yet. You're right. It's not scheduled. Let me see. I will ask his office to
Thank you.
to reach out to you.
I didn't know there was 2 other drivers, so of
Yeah,
course.
so he talked to you about 3 things. The first thing is the bicalutamine. That's what you're on right now. That's the one he said to start now.
Okay.
The other one is a shot. It's called a Lupron, and then that's another one is a pill. Or that's actually 4, but 2 of them kind of come together.
Okay.
The abiraterone and prednisone,
Okay.
and he recommended that for 2 years
Okay.
total. So
So I'm ready.
Yeah.
whenever. Because I'm a poster child for why men should apparently have their prostate and PSAs done a lot sooner than I did.
yeah.
Because that I literally 9 months ago I thought PSA was the old airline in California. I didn't even know what a PSA was.
Oh wow, that's
So
yeah.
it's like today I have a friend, and he's going to the doctor, and I'm like, get a PSA. Anyway.
Yep. But yeah. So what's I gonna tell you? And last time we talked about the different regimen. You still right now we're planning to do on a 6 weeks radiation, right?
Okay.
Is that what? Because remember that time we talked about the 8 weeks or the 6 weeks.
Well, because the 6 weeks was a bigger
Yeah.
dose.
Yeah, higher dose,
But-
but the same biological effective dose in total.
Yeah.
You get higher dose every day, but you get that sooner. So
Correct.
and that's what you told me you wanted to do. So
Yeah.
right now we plan for that.
Right.
Yeah. And when we start, I can't change the dose
I
in the middle.
understand.
Yeah.
I understand.
So-
But that's still 2 months or a month and a half out. or
Yeah,
whatever.
but in reality, your treatment is going to be like 2 years because you got to do the hormone for 2 years at least.
Correct.
So the hormone is part of the treatment.
Right.
Yeah.
But the radiation
Is the main
big
part
deal.
in a way. Yeah,
Right.
it is.
Right.
But in your situation, though, I think the hormone plays pretty much just as important of as a role given how those lymph nodes.
Okay. That's good to know. Right.
Yeah. Yep.
Okay.
Yes, sir. But otherwise, no new issues since we talked.
No
new problem. Pooping the same.
Yep,
No blood, no pain.
No. They're feeling good.
Everything flowing okay.
Yeah. The medication for the bladder has helped that problem. Hadn't suspended it, but at least I can get to the bathroom now. So
Got it.
that's good.
That's good. Yeah.
Okay.
Okay. Yes, sir. Let me see you back in a month. I'll discuss your case at the tumor board after I've talked with the radiologist over there. If there's anything new, any update, I'll let you know. But to be frank, I'm not. I don't think many surgeons would be too excited about operating with this PET scan.
Yeah. No, I'm not excited about that either. But I think I'm more excited about maybe starting the radiation as soon as possible.
Yeah.
Whatever works with the protocol, of course.
Yes,
So.
Absolutely. Yeah.
This is that little image thing there. Really, I got to tell you, it was a shock to the system to see the picture.
Oh yeah, I know.
I mean, it's a very it puts it in perspective,
Yeah, I gotta tell you.
And just the way it glows, and it's like. It's not humorous anymore.
Yeah, a lot of this stuff is normal, but
It's what now?
This stuff up here is normal, like the kidneys, because you pee it out, so the kidney light up, your ureter light up. So I wouldn't, But
no, I knew. You showed me where you were. I got it. I got what you were talking
that's
about.
bladder, that's normal, but beyond that, that's the prostate, that's not.
Right.
The lymph nodes, that's not.
Yep.
Yeah.
Okay.
Yes, sir.
Well, thank you.
Thank you, sir. Any questions for me?
No. Nope. I think so. Do I handle the appointments, or do you set it up?
We will put something for you to see me in a month. So we'll do
Okay.
it today.
All
But for the other doctor though, I have to